Okay.
Good. Go ahead, Shweta, and do share your
Yes,
story.
sir. I come across this course only while doing my internship. I don't have big success stories to share
No problem.
because just now I completed my internship. Only last month I have completed it.
Okay.
So, but that time I wasn't confident to do all the exercises on patient, and even in the assessment also, like I will have a fear that is it right or wrong. Only I have in a particular joint only I have only 4 to 5 exercises to teach because only that much I know. They will cover all the theory part, but in the exercises part only they'll tell us to do self studies. But exactly I don't know like which exercises should be, or the complete blueprint which you gave in the PBPA approach, no, they didn't teach. So I don't have enough confidence to touch the patient also. But after going through this course, it is like I gained a lot of confidence and knowledge about not only the anatomy part but also about the exercises. So that's the thing.
Right.
So, like as everyone said, L3 also will be like mostly more than expected than L2. But at the first, but I thought the language will be more barrier for me. But it is very like full and full. It is taught in English, but that is quick understandable in Hindi also.
Yeah. Right.
So and Dr. Sandhya is also like she's a really good mentor for me. She assisted me in all the doubts. Whenever I ask her, she's always she tells me every doubt and she clears on time. So that's the best thing. So about this course.
Okay. So you are currently working, or how is it, Shweta?
No. I'm not even graduated in my bachelor's course. Next month only I'm getting my degree.
So you'll be completing your course in this month. Okay. So what's your plan now? Then post graduation as such. Okay, you are planning to open a clinic, or you are planning to go for a job first? How is it?
Yeah, only for 6 months. Obviously I'll go to a job because I should get some experience to start a clinic. This is more than enough, but still I should get some. Because in my home also, if I tell I'm going to start a clinic, I don't know how they will react. So obviously I'll go to a job, then I'll just practice some more and get the experience, and then I'll be opening it.
Right. So even when you practice, make sure that you implement this method as such. Okay. So just don't go for a prescription-based method as such, because if you do that, you will be losing all your the confidence again. Okay, and you'll be losing. See, knowledge when not used becomes a garbage, right? So that's the reason. Sooner the better, I would say. Okay. Yes, you may have this confusion. See, we know the nerves of the people actually. Okay, physios especially. Okay, what they are thinking, why they are not opening. Okay, so we have learned through the nerves itself, right? So you may be thinking that probably I may get married and I may need to shift to another place. So is it that post marriage I'll open a clinic? Okay, so never ever do that. Okay, the moment you have that confidence, okay, which you have right now itself, okay, start a clinic. Okay, shifting does not take much time. The machines shifting and the accessories and the things that we are going to have as a clinical setup as such, okay, it can be shifted in just some 2,000 rupees, 3,000 rupees by even ordering that Agarwal packers, or so many packers are there. Okay, you can just ask them to shift to any place as such. Okay, so it's very easy job. Never ever do that. I will open only when after marriage as such. Okay, that is never going to be a challenge. Okay, secondly, once you start having that, gaining that confidence, treating the patients in your clinic, then sky is the limit. Wherever you open a clinic, you start from the day one with that confidence. Okay, what happens, the way probably your parents cooperate, see, I'm not saying everyone, maybe your in-laws or husband may not be having that patience. Okay, I'm not saying they do not have. I'm saying maybe it may be possible. Depends on the people whom you are going to marry. Okay, it all depends. You never know, right? So what happens is, when you are confident, practicing at this age independently, even the person who is marrying you, okay, will have a certain confidence. Because she's working independently, she's running the clinic independently, right? So you'll be more respected, right? And you'll be more honored, actually, right? And the support from your in-laws family right from the beginning is set, right? The expectation is already set. Okay, when the expectation is already set, okay, then they invite any challenges, okay, post this thing, because you have been accepted with this expectation, right? Otherwise, what happens if you are prior to marriage, you are doing a job, okay, post marriage, immediately, you may not be able to have, you may not have that confidence to start a clinic. So
Because
what
you have to manage new family,
Yes.
new people, though they are cooperative, everything is new. And
Right.
just now you have seen the feedbacks of fellow colleagues also right now.
Right.
Okay.
So you have a dual responsibilities
Yeah.
there. So when you have a dual responsibilities, okay, family always takes the first priority to begin with, because it's a new family, right? So you can't oppose, right? So when you do it, right at your parental these things, okay, guidance and parental this thing, okay, the moment you go there in the new family, you'll have only one responsibility. That is, yes, ye hai, but I know I'll be able to run the clinic, these things. Okay, because it is already set. Okay, it is just a question of seeing an premise. Okay, ye karo usko, set up karo, then start off. Right. So that's an advice for you. Right. Okay. So nice. And what is the one suggestion you want to give it to the physiotherapists who are thinking either about the physiotherapy is a second option, or even this course? What is it?
Sir, I will tell without any doubts, just close your eyes and join to this course, because no academics will teach you these exercises and every assessment according to the conditions. So I'll obviously tell. Already I told my friends also to join this, sir. So that's
Right.
the thing I'll be telling.
And did you face any challenges while joining?
No, sir. First, I was like, I have a doubt that the language will be the first thing, and that was fully on my mind. But that is totally, I experienced there is no difficulty in that.
Okay. Okay. Good. So you're from Chennai, right?
Yeah, sir.
Which place? Which location?
Sir, I'm from Ramapuram, sir. It's near Ramapuram. It's near SRM College, which is a known university here.
Okay.
It's a big
So I was working with a company called Kaburandam in 2003-2004, which is a Murugappa Group company. Okay. It's a Chennai-based company. Okay, industrial estate as such. Okay. There is one Chowk also, right? That chocolate name. Okay. So they have almost 17 plus companies, and it's a very Cholamandalam Finance as well is there.
Okay.
Right. So very good company. In fact, when I met with that accident, okay, they helped me a lot. A huge help basically has come from that company itself, because I was in that company, Kavarandam Universal Limited as such. Okay, Murugappan is the chairman of our these things. Deepak Durai Raj is the person whom I was reporting. Very nice people. They helped me a lot, and I'm always indebted to that company and the people who helped me out in that, actually. Right. So thank you so much, Shwetha. Okay, keep rocking, and make sure you start your clinic soon, and do share your success stories also. Okay, but if you do a job, same advices as we have given to Yasmin. Okay, you have seen that. Okay, and do continue with it. Right. Great. Thank you so much.